Dr. Petty, I was going to ask you a follow-up question as well, because you practice in India. And so I was wondering if you could speak a little bit to any unique considerations for patients outside of the United States in your local practice. And as a community provider, is there anything you might want to share with other community physicians about participating in clinical trials?
Excellent question. So quite often in India, as you know, the affordability of the patient varies quite a lot. The insurance sector is not reimbursing most of the IBD patients, so that's a big gap here. Unmet need is insurance coverage as opposed to Western world. So most of my patients, they got advanced disease, but they can't afford biologics. So where do we go with these patients? They are suffering, and the simple medication is not working. They can't afford biologics. They keep on roaming from one doctor to other for hoping that the other doctor will provide a magic solution, which is not the case. So if these patients, if there is a trial opportunity, that's a fantastic opening for them where they can get access to most modern medicine at no cost, which is supposed to be, as Sid already mentioned, Dr. Singh already mentioned, the clinical trials, you look at the development of clinical trials, the current clinical trials are supposed to be more efficacious, more safer than, say, for example, clinical trials that happened 5 years ago. So you are accessing all these newer medication which are very effective, very safe, and the entire team is working for you at no cost. And in fact, as we already discussed, all the tests associated with patient journey, whether it's CT scan or colonoscopy, blood test, everything gets reimbursed. So for a patient who is not affordable in India, that's an excellent opportunity because otherwise they can't access biology, they can't pay for that, there is no insurance coverage, and so if they can enter the clinical trial, that will solve most of their problems.